Hi, I'm Dr. Phanisri. I practice in Banjara Hills and Madhapur. I get a lot of hair cases. 50% of my practice is of hair. I do a lot of hair regrowth sessions, different kinds of sessions, more advanced ones. And there are coming to the types of hair loss. There are different kinds of hair losses depending on the age and the hormones and the family background and all that. One kind of a hair loss is a diffuse one, that is overall thinning of the hair. The reasons for being like nutritional is one reason. One thing is, again, under nutrition we have different types. One is iron deficiency in females, B12 deficiency, D3 and calcium related deficiencies. Second one is a hormonal. Hormonal again can be during pregnancy, or it can be a male pattern baldness or the female pattern baldness. And hormonal again can be due to thyroid issues, whether it can be hyper or hypothyroid. Another thing is female related issue, that is PCOD, can also give rise to hair loss. Coming to the hormonal hair loss, that is the male and female pattern baldness, is the main hot topic in the city. One thing is male pattern baldness, that is also called as androgenic alopecia. This is because of our male hormone in excess, that is the dihydrotestosterone when gets excess causes male pattern baldness. It is in the families. Mostly it is in the families. Otherwise also it can happen due to mutations. It can start in the new generation, though it's not there in the family. So in this kind of hair loss, you find the hair being lost mainly in the front part of the scalp. That is a classic type in which there will be receding of the hairline, and there is a pattern in the sides of the head scalp. Previously it used to start in 30s. Nowadays people are getting in it's starting off in early 20s, maybe because of the added pollution and the stress. In this if it's in the early stages, we can actually postpone hair transplantation. So initial stages, when the client comes, I have a lot of solutions for that. We can actually regrow the hair over a period of 6 months. Initially you won't find the hair loss in your comb or when you wash your hair. It just thins down the hair, thins down and then falls elsewhere. So you cannot really catch the male pattern baldness. Even in males, you have the female pattern baldness, wherein there won't be much receding in the front, but in the central part of the scalp you will have the very very thin hair, and also at the back. So in this type of hair loss, you need the hormonal correction and also some different kinds of hair solutions and tablets. First of all, what we do here is diagnose the kind of hair loss. So there are different methods here to differentiate what kind of hair loss you actually have. So once we get into the main root cause, so we treat accordingly. So commonly if a patient requires regrowth, I go with a lot of procedures like mesotherapy with different materials, and PRP. PRP is platelet rich plasma, wherein we draw blood and prepare growth factors here itself, and we do the treatment. And the equipment used is all US based. The tubes what we use in PRP are FDA approved, and we draw the blood, prepare growth factors there and then induce onto the scalp. So it is totally a painless procedure, and it is the patient has to spend at least 1 hour here, and it's been a really great success with my sessions. So do try it if you have hair loss here.